All right, today we're jumping into a condition that affects millions of people. It's incredibly common, but you know what? It's also one of medicine's most confusing puzzles. We're talking about irritable bowel syndrome.
So, picture this. A patient walks into their doctor's office with really debilitating symptoms. We're talking serious abdominal pain, diarrhea, bloating. You run all the tests you can think of, blood work, scopes, imaging, and every single one comes back totally normal. So what in the world is going on? Well, that is the central mystery of IBS.
Irritable bowel syndrome, or IBS, is what we call a functional bowel disorder, and this part is absolutely crucial. The symptoms, the pain, all of it are 100% real. The big distinction here is that there's no structural problem. No inflammation, no tumor, nothing you can actually see on a test that's physically wrong. The problem is all about how the gut functions.
And get this is not some rare, obscure condition. IBS affects a staggering 10 to 20% of people all around the globe. It's actually one of the top reasons people go to see a doctor in the first place, which makes cracking this case even more important.
Okay, so to start our investigation, we have to begin with the clues. And in this case, the clues are this really complex and honestly often confusing cluster of symptoms that people experience.
So the absolute hallmark symptom of IBS, the one you have to have for a diagnosis, is abdominal pain. It's usually kind of crampy, it comes and goes, and it often gets way worse with stress or after eating. And that pain is always paired with some kind of change in bowel habits, either constipation, diarrhea, or sometimes a frustrating mix of both. On top of that, many people deal with gas, bloating, and that feeling that you just can't quite empty your bowels all the way.
We can generally break patients down into three main groups based on what their bowel habits are like: IBS with constipation, IBS with diarrhea, and a mixed type. Each of those makes up about a third of all cases. But here's another layer to the mystery. These subtypes aren't set in stone. A person can actually flip from one category to another over time, which just makes it even more puzzling.
Okay, so if there's no blood test, no scan, no single thing to look for, how on earth do doctors crack the code? Well, it turns out the diagnosis is all about recognizing a very specific pattern of symptoms.
Doctors use a kind of diagnostic checklist called the Rome criteria, and it's pretty specific. First, you need that recurring abdominal pain. Then, that pain has to be linked to at least two of these three things. It tends to feel better after you have a bowel movement, it started around the same time your bathroom habits changed in frequency, or it started when the actual form of your stool changed. See, it's a diagnosis based on patterns, not on finding something physically wrong.
Now, one of the most important jobs for a doctor here is to rule other things out. So symptoms that are chronic, that are tied to stress, that kind of come and go, those all point towards IBS. But things like symptoms starting for the first time after age 45, seeing blood in the stool, losing weight without trying, or having diarrhea that literally wakes you up at night, those are huge red flags. They are not IBS, and they mean a much more urgent investigation is needed right away.
All right, we've got the clues, we know how to spot the pattern, but we still haven't answered the biggest question of all. What is actually causing this? Well, welcome to the big reveal. The answer lies in this powerful and really complex relationship in our bodies. It turns out IBS isn't just one single thing gone wrong. It's what we call a multifactorial disorder. The gut itself might be moving too fast or too slow. Then you've got this incredible two-way communication superhighway between the brain and the gut. We call it the brain-gut axis, and in IBS, that communication has just gone haywire. We know for sure that stress and anxiety pour fuel on the fire, and for about a quarter of people, the whole thing kicks off right after a nasty stomach bug.
But out of all these factors, if you're going to grasp one concept, this is it: visceral hypersensitivity. The best way to think about it is like the gut has a faulty alarm system. For people with IBS, their internal pain receptors are just way too sensitive. So normal everyday stuff like gas moving through your intestines or the natural stretching after a meal, things most of us wouldn't even notice, are perceived as intensely painful.
So here we have it, the solution to our medical mystery. IBS is a disorder of the brain-gut interaction, where completely normal things happening inside the body are being perceived by the brain as abnormal and painful.
Now that we've solved the mystery, we get to move on to the most empowering part of this whole story. Because once you understand the cause, you have a clear roadmap for how to manage the symptoms and finally find some relief. The approach to treatment is really logical, and it's done in steps. For milder cases, it often starts with just education, reassurance, and some simple changes to your diet. For more moderate symptoms, a doctor might add things like fiber to help regulate things, or antispasmodics to help with the pain. And for the most severe cases, and this might surprise you, we often use low-dose antidepressants, not for depression, but because they are fantastic at calming down that overactive brain-gut axis and turning down the volume on those pain signals.
Diet plays a huge role here. Avoiding really common triggers like coffee, certain artificial sweeteners, or foods that produce a lot of gas can make a world of difference. But the goal is never to create some crazy restrictive diet. It's all about finding a balanced, healthy way of eating that just works for you. And fiber, especially something gentle like psyllium, can be a game changer for regulating bowel habits, whether you're dealing with constipation or diarrhea. So let's bring it all home with this final key takeaway. The problem in irritable bowel syndrome isn't a flaw in the body's structure. It's a really complex issue of function, how the gut is working, and perception, how the brain is interpreting the signals it's getting from that gut.
And this leaves us with a pretty fascinating thought to end on. We've managed to unravel the mystery of IBS by finally understanding this brain-gut axis. So how might this powerful connection change the way we look at other chronic conditions we've struggled to understand, like fibromyalgia or even chronic headaches? It really does suggest a whole new frontier in medicine is opening up.